Доброго дня.
Good afternoon, esteemed colleagues, journalists, representatives of business and NGOs. First of all, thank you for coming. I would like to thank our participants of the discussion, the Deputy Minister and the representative of MCHM and the doctors, business and the representatives of patient organizations for finding time to discuss this very important topic. This is the topic which is rarely discussed in media, and that is the topic on cooperation or interaction between the business and the state when it comes to medical difficult problems. On the one hand, we believe that business is doing something and the state is doing something, but in fact, only in cooperation we can address certain things and we can resolve them. This is happening at the initiative of the American Chamber of Commerce, which is doing a lot for socially responsible business. And I would like to give the floor to Andy Hunder, the president of the American Chamber of Commerce in Ukraine. He will tell us why the PPP is so important and what is business doing. And another important story, does business expect from the state? What is business ready to give, and what does the business expect to get from the state? So we are talking about these things. Thank you, Natalia. Thank you, ladies and gentlemen. I'm happy to be here in the UCMC. This is the platform which unites and gives lots of opportunities, and it unites today so different representatives of different sectors. And this is great that we can talk today, we can hear each other and understand where we can move forward. We as the MCHM that works in Ukraine, we represent 600 companies, organizations. We unite them, and this is mostly business, large companies which have been working in Ukraine for more than 20 years. Next year we'll be celebrating our anniversary of the work in Ukraine. And what is the chamber doing? We are the voice of the business, of the authorities. We are the consolidated voice. If you look at how we do it, we have 15 committees and 20 working groups. So they're very specialized on each of the different sectors, healthcare, customs, taxes. And there's one group which hasn't been very active for the last 2 years. We looked at the latest documents. We had a very active group on PPP, public-private partnership. And when we looked at that, we realized that we have done so much on PPP in healthcare. And now I will just enumerate all these documents, which are very specific papers. That was 2014 because of different reasons. And that was the issue which was not so much highlighted in our agenda, and I'm happy that we are now here discussing that. Sometimes we shouldn't be inventing a bicycle. We need to look at the experience of European countries and other countries of the world. And we see that in the latest 10 years that was a boom because PPP in the system of healthcare. We see such countries as Great Britain, Italy, Spain, Portugal, which show very good examples of what could business do together with the system of healthcare. And here it is important to understand what it is. This is a long-term contract with the state body and the company from a private sector. We are happy that we are discussing it again. what could the private sector, such companies which are members of MCHM, both in Ukraine and in 43 countries where the MCHM is present, plus the headquarters in Washington, D.C., across the road from the White House. And these are important questions, important issues, not just for business, but for the system of healthcare and for the society. And that is why for us to be included into the process of reforms which are taking place in Ukraine, especially into reforms in the healthcare sector, is important. We are happy that the voice of business could be heard. What are the opportunities? Today's meeting is unique because it unites different spheres. And if we look at PPP, this is about three key directions. First of all, that's infrastructure. The infrastructure, what is the infrastructure? What are the premises where we can look at the projects on PPP, on assets management, and that's management of the building, management of the heating system, and some very specific issues like security, cleaning, providing the catering services, and others. And the experience which Europe has is great, and we are happy to share these best practices from Europe. So to put it briefly, we have been doing a lot, and we are ready to share what we have done already. And business is really ready to work. That's important. And because the time now is such that we are concentrating on the continuation of the reforms, this is important for everyone. Thank you. I will be happy to answer your questions. Thank you, Andriy. Thank you for your comment. I believe this is a very important story when business understands its own responsibility when they work in the country where there are changes in the healthcare sector. But on the other hand, when the Ministry of Healthcare, the state, understand their responsibility, and they can count on business in addressing some social, even medical issues. And I would like to give the floor to Oleksandr Linchevskyi, Deputy Minister of Healthcare of Ukraine, and ask such a question: what are the needs? Very often you know probably about that. You're the doctor. Business decides on itself. There's some assistance needed, and then business buys some equipment, organizes some awareness campaigns, even though one campaign cannot address some big problem. So where would the ministry see the possibility for cooperation with business, and what should be the rules set so that it works and works in synergy when something is done by the ministry, by the regional department of healthcare and business? Thank you. Thank you. Our position is very simple and obvious. Frankly speaking, we've known about this initiative, about Ronald's house. We were looking at it, and we were asking when will we have it? Now we have. For the doctor, for the ministry, the patient is always in the center of attention. We ask ourselves, what do we need for quality treating the patient? We need the hospital with such and such and such requirements to it. There should be a doctor, qualified, armed, motivated. The medicines are needed, high quality, affordable. Then we need rehabilitation, which will return the patient to full-fledged life. What does a child want? What does a little patient want? We have to step away from the Soviet system, where the system was perceiving the patient as details in a plant, as some conveyor. There's patient A who has some spare part B, and that's extra spare part, and the surgeon would cut off this spare part. But this shouldn't be so. What does a little patient want? He wants to be, or she wants to be, with the mother. That's what it starts with. That's important, not just from the point of view of the geography, of logistics, of providing assistance to children. We know there are 30 hospitals for adults in Kiev. How many children hospitals? 1, 2, 3, to say nothing about specialized assistance. It's localized in certain hospitals, and it cannot be in every village or town. This way or that way, our mothers with their sick children have to be far away from home. What does the child want? The child wants to be together with the mother. And we have the problem with ADPs, with the lack of highly specialized medical assistance on the territory of Lugansk and Donetsk regions, where some of the hospitals and personnel are lost, and it is impossible to provide high-quality assistance, and these patients have to be treated in Kharkiv, Dnipro, Odessa, and Kiev. That means traveling, that means staying in other conditions, and that is why the Ronald's house is so important. What else does a sick patient want? A patient wants to be with the mother. What is good for our little patients is good for the ministry and for the state of Ukraine. We'll be helping in anything which is done in this direction. We are ready to provide contacts, information, to help with documents, permits, to help with the transparency of such partnership. We are very much interested. The final result should be achieved. The patient should be with the mother. Thank you. I hope that the regional departments of healthcare and chief doctors will hear you. They will believe that the parents should be together. That is the natural desire of every doctor. It's not about me or someone. That is what everyone wants. That's logical. That's normal. That's better. That is our joint desire.
Thank you very much. And now I give the floor because Oleksandr told us about Ronald McDonald House and the foundation we spoke about, and this is the possibility for public and private partnership in order to solve some social problems. And it is important that children were together with their parents, and I hope that we go this direction. And I give the floor to Grzegorz Chmielarski, General Director of McDonald's Ukraine, head of the Supervisory Council, Ronald McDonald House in Ukraine. And we're going to discuss the issue, why this family-oriented medic is of importance, and we will be able to discuss it in a wider circle. Thank you. Dear friends, the main part will be in Russian. I understand Ukrainian, but it is easier for me to speak Russian because I studied it at school many years ago when I was a child. So what is McDonald's? Everyone knows very well, and I hope that every person had the opportunity to be our customers. And Ronald McDonald House is a new thing. We as a company in Ukraine, we work for 20 years, and next year we will have 20th anniversary of our activities in this country. And from the start, we had the role of corporate and social responsibility, and we carried out this role. And we had such areas as fundraising in our restaurants, and also we provided some money from our profits, and there was a program, Hand of Happiness, and we understand that the exchange rate of hryvnia changes and the sum differ, and if we in the sum 28 million hryvnias, and we bought equipment for this money, medical equipment that we provided to different hospitals, to children's hospitals, for more than 50 such hospitals throughout Ukraine. And now it's time to start the activity of the foundation that was created 40 years ago in the United States. And this is a fund that works in more than 60 countries of the world, and the founder of this fund is McDonald company, and it is not a fact that it manages the activity of the fund. And you can see Andy, you can see Pavlo, who are together with me and other people who work in the on the council of this foundation here in Ukraine. And the goal of the foundation, not just to buy equipment and to provide it to the hospitals of the country. There are several areas in which we work. The activity of McDonald House in the world, the activities are different, and we chose such a program that is called Room of Ronald McDonald. And this is a room. It can be 50 square meters or 30 square meters or 60 or 80 square meters, depending on the facility. And this room is in the territory of the clinic or hospital. And in this room, parents can stay, those parents and relatives who came to visit a child in hospital, or who not only visit but who stay with their child in this hospital. So this is a room for recreation. You can get tea, coffee there. You can even solve some technical problems, because there are conditions, there is a shower, laundry facilities. So, and I would like to share my own experience. 5 years ago, my younger child fell ill, and to get to the hospital, there is such a hospital as the Center of Children's Health that was built in 1970s. It was built for the money provided by the society, and it is in Warsaw, where the family lives. But this is another part of the city, and it would take 2.5 or even 3 hours to get there. And we decided, together with my wife, that she would stay with the child, and I have a successful life, and I was able to get to stay in the hotel, and I went after work to the hospital, and we saw that a lot of mothers, they want to be with their children, but they do not have such an opportunity because they cannot afford to stay in the hotel. That's why they just slept near their children on mats. And during our conversation, it was revealed that this room of Ronald McDonald and this hospital was really huge. It was really good contribution for those mothers because this was the place that they described in really good words, and they were really grateful for this room. And I would say that this is such a solution that helps to solve practical, real problems. This is one thing, and I also visited this room, and my wife also visited. And when my child underwent some procedures, so she didn't wait, she just went to this room. And this room is a place for communication among people in difficult times when the child is in hospital. This is the opportunity for parents to communicate with other parents. This is help to parents. And this help to parents, we know that the presence of parents in the course of treatment of their child is really important. This help to parents also contribute to the treatment of their children. And also one more direction in which foundation of Ronald McDonald House work. This is the house of Ronald McDonald, and here I would like to share the experience of my homeland in Poland. McDonald in Poland works 5 years longer than in Ukraine. So 15 years ago, McDonald created such a foundation, Ronald McDonald House. And this foundation works in several areas, one of which is rooms, and the second area is house of Ronald McDonald. What it is. So 1 year ago in Krakow, near one of the hospitals, the hospital that is for children and that was built in 1960s for the money provided by Polish diaspora from the United States and Canada. The decision was taken that near this hospital there should be a house built. And there was great cooperation with the hospital, and this hospital belongs to the state and to the university, and for zero money Ronald McDonald got land for free for 40 years, and the condition was that they will build a house. So we should understand the scope of the task. This is not just the task for today and tomorrow. We should wait a little bit. In order to build such a house, the cost of construction was about 2 million euros. So there are some conditions, and I was inside, and it's like a hotel, but for parents. And if you look at this hospital, this is like 4-star hotel, very good conditions. And also there is space for people, for parents who can communicate with each other, share their experience, their emotions with other parents. And I told you about the cost of 2 million euros, but it happened so that it was the cost of this hospital 1.5 million, because of 500 could be saved, because different companies that usually did not cooperate with McDonald or Foundation, but these companies, they wanted to participate. They provided good discounts for their products, or they provided something for free, or they provided their services for other money, not the market price, was established. And due to this, it was possible to build such a house, and the house worked for a year, and it is 100% occupied. And in the majority, these are mothers who live there, because you know that men, they earn their living, and you know that sometimes both mother and father live there together, and the stay there is for free, 100%. So if someone have money, so they can just contribute as charitable contribution, but mainly this is free of charge staying. And sometimes parents live there for a full year or more. And this is not only these are not only Polish families, but also there were some Ukrainian families, because in Krakow, you know that there are Ukrainians who work there or study at the university. And so this house, it contributes a lot. Everyone understands that this is very good help for parents, and through parents, this is great help to children. And the foundation in Poland, they fundraise for the building of the second house in Warsaw. And I hope that, why did we say that we are in the zone of this corporate responsibility? We worked in this area for long. And why the establishment foundations was so important? Because we reached the conclusion that Ukraine is ready to cooperate. Ukraine is ready for public-private partnership. It will work. And the conditions for the work of such foundation, and the contribution of the state power, because you know that these houses, they are constructed on the state lands or in state facilities. And this is the approach of the state. It is like this that we can really solve this problem and start this project. Because before we were unable to do this, to start this work of the foundation, we need changes, and they happened, and it helped us in our work in social area. And we hope that our work will be productive, and each year in November, we fundraise in our restaurants, and our visitors contribute. They fundraise, and we fundraise. We are technical holder, and we add our own money, and then this money is provided to the account of the foundation. And I hope that next year we will have real opportunity to open first Ronald McDonald house, and this will be great achievement and the first experience that will help us to work for the future. Thank you very much for this. Thank you. Thank you very much. Thank you, Grzegorz, for this important information, and we welcome you with the start of the work of the foundation, and we hope that these houses will be open, and state clinics, and everyone will contribute to this. And I would like to ask Yelyzaveta Shunko, and she is Director of Neonatology Chair, and we have representatives of business here who consider what areas they are going to choose for their activity. And you know that recently, due to the Ministry of Healthcare and NGOs, there is opportunity to have access to emergency rooms, and now there is wonderful initiative that parents can be with their kids at hospitals. And why this cooperation is so important, and what prospects do we see in this area? Newly born child, especially if it is born prematurely, it has close link with his mother. And this link is a psychological and emotional at some psychological level. And if we are speaking about help to newly borns, so these children that were born earlier, so the quality and result depend clearly whether there is a mother near the child, whether the child feels this protection from his mother. Newly born child and prematurely born children, they when they are breastfed, when they are at the breast of their mother, they feel comfort. So we doctors, we save lives of newly born children and prematurely born children. But you know that not only medicines, not only equipment save children, but also the family that is near, mother who is with her child, who breastfeed, and there are many scientific research and social surveys that show that those children that are treated being with their mother, even when they are in the emergency room and they feel the presence of their mother, the results of the treatment is better. And if we are speaking about healthy development of the state, if we are speaking about healthy generation of those who will be successful in the future, it is important to have this family-oriented medical care. And I like this direction very much, because without the participation of the family, it would be really difficult for us doctors to work. And we do everything possible in order to bring family closer to their children who are in hospital. So we have special rooms, special emergency rooms for children. When the child is prematurely born, they should be close to their mother, to the breast of their mother. And I believe that we have medical staff, we have facilities, but there are no conditions for the families who come to Oleksandra or to Kiev for special treatment, to the hospital. This family should have place where to stay to, where to communicate, where to spend some time, because the stress of birth is not only the stress for the child, but also the stress for the whole family. And we should contribute to unite child, mother, family, and to improve results of treatment. Thank you. So we are speaking about children who were prematurely born and undergo treatment, and the foundation of Ronald McDonald supports in many countries these hospitals with whom doctors work in these rooms, and this is of importance. So we will see how it will develop in Ukraine.
So we will continue the medical topic, and I would like to ask Pavlo Silkovskyi, who's a doctor, the anesthesiologist at Rivne Regional Children's Hospital. He came from the region, and I would like to ask you, what is the role of the doctor in the process? We understand that it is very important in treating patients, but in order to not to have barriers when people want to organize such a room. So, because this is important, maybe you will address the doctors. I will repeat a little bit because really historically in the ex-Soviet Union, in the Soviet Union in the past, all the hospitals were designed in such a way that the patient would be treated as an organism. It was when a lady would get to a maternity house, she would get to like a prison for some time. When a child would get to rehabilitation ward, it was also like being detained for some time. It's good that the times are changing. Now we have open maternity houses. The intensive care units are opening. I work in intensive care unit and I see how parents are next to their children. When I was in the US some time ago, I went to an intensive care unit and I saw the families together with patients. It was a shock for me, and I asked the doctor, how do you explain it? He first could not understand what I am asking about. He said the child who gets into the hospital gets a big stress from the disease, from being surrounded by some strange people. If we take away the family, then what recovery could we be talking about? Fortunately, we are understanding it also now, and I can talk about my hospital, my administration. There's full assistance to that, and the role of the doctors and the administration and their efforts are directed towards opening maximum the doors for parents, so that they're not just the visitors, but they are our partners, so that they help in caring for their children. And even the best nurse will never take care of a patient like a mother will take care of a child. The project itself, the project of hospitals, does not envisage to stay a long time together. But there's another problem. The parents, from a formal point of view, have the right to stay all day next to their children, but they have some things they have to do. They're given a package of some clothes and they have to wash it. They have to spend night somewhere because there's no place for them to stay at night, and they have to go somewhere. But at the same time, how does the child feels the need to be next to the mother, and the mother also feels this need to be next to the child, and the sick organism feels it much stronger. Maybe the men will understand me. I will give you an example. If a woman is sick, she is running a temperature of 38, she can do something. If a man has 38, temperature of 38, and he is expecting at least one nurse to be next to him. A man is like an adult child. We can understand what a child feels. If you smile, you understand what I'm talking about. And that is why there is this very big need. And in my hospital, I see such things. Parents bring some, just stay in the corridor during the night. They cannot stay in the intensive care unit. When they are said that you can go to the hotel, for some it is expensive. For another one, he says, I'm concerned that something might happen to a child and I will not be next to the child. And it is very important to have for them some premises where they can make some laundry, where they can take some rest. And I would like it to happen not just in one hospital, but in all the hospitals of Ukraine. And that is why I thank the foundation Ronald McDonald House. And I would like to also thank all who joined and who will join this initiative. Every good thing that we make returns to you, especially when you require miracles. So good luck to all of you.
Дай Бог, щоб так і було. І закінчимо.
And we will finish our discussion. We probably had to start with it, but we will finish with you. I would like to give the floor to Oleksandra Balyasna, the head of Association of Parents of Premature Infants. What we are discussing is important. How do you assess these perspectives? How much important it is for parents, for children? What would you like to say to business, to the ministry, to doctors? First of all, as a mother of premature infant, I can say for me it is very logical that a mother should be next to you. When a baby is put on your breast from the birth, that is very natural. This period should last all the time. When the mother, father are next to them, then the child feels protected, and that's the foundation for rehabilitation. For us, this is no question about how this should happen. This is objective. We'll do everything. Who probably does not understand fully how this should be how this should be organized. It is important to explain to our mothers and doctors that this should be cooperation, 50-50 responsibility. Parents have same responsibility as doctors. If emotionally a child is not stable, has no contact with the parents, then the process of treatment will go with complications. And that is why without our information support, this will be difficult. We are working on that. And third, I would like to say that because our organization has just joined the International Association this year, and the international patient organizations have been working in this sphere for more than 30 years, and I, for the first time, got to the hospitals where there are such houses. I could understand that very soon this should be happening in Ukraine. I'm grateful for this first step because I have never received any request from the parents who were looking for some. If I wouldn't receive such requests from parents, I wouldn't know about that. For me, it's also a very painful issue. We are for having parents next to their children. I would like to thank for the initiative and for everything that is done in this process. Thank you. On this positive note, we will complete our presentations. If we have any questions, we'll be happy to answer. Maybe you have any comments. Yeah, you're welcome.
Address your question and introduce yourself. Andrei Migel, Institute of Liberalism. So I know that we had other help. We had some emergency room equipment for these rooms provided, and we know that the American Chamber of Commerce also work in this area. So what are the main areas, what are the main things that people can do in the regions? Because we understand that this house will be in Kiev, and what will be in the regions. It's not the fact that it will be in Kiev, maybe in some other places. So what are the needs, and how this help can be provided in the regions? So maybe help is needed everywhere. So we should find out where to start from. And if we are speaking about Ronald McDonald House, so we have children's hospitals, and there is a list of such hospitals, and we communicated about it informally, and we provided a list of those hospitals in the regions where children are hospitalized from other places. So there are different options for cooperation. So this house, the building, and other help that can be provided. And we have already started to work on this. We had preliminary discussions, and we hope for results. And it's not only about Kiev. And what are other important issues? Not only the question of Ronald McDonald House, but what are the other areas of cooperation in the field of public-private partnership? So there are communities that see their own needs better than everyone else. And we as the ministry, we are ready to help them and to help this cooperation of social projects and hospitals. So we shouldn't say what they do, for example, in other cities. So we should just motivate and coordinate the work. Thank you. We heard this now. The next question. The representatives of business have the question. This Ukraine company, I would like to continue the thought of Mr. Linchevskyi on the community, because for the business it is important on what territory it works, and it can provide assistance to these regions. And in Trostinets we have a factory, so we have in Trostinets, in Stary Petrivtsi we have, in Vyshgorod we help there also, and we should understand the needs. We bought equipment, medical equipment for small children, for Central Hospital, and I would like to ask Mr. Grzegorz. He said that there was a case with his son that they had to go to other part of the city. I wanted to ask about the houses. Are they built in close vicinity to the hospital, or it takes some time to get there? And what is the equipment in these houses? Is this like hotel, and you know the situation, how it functions, how it operates? Are there conditions for doing some washing or other things? And also about the rooms. First, you should understand that I have experience with this Ronald McDonald House that I saw in Krakow, and what I was told by my colleagues that deal with these projects in Krakow. And around the world, there are many such houses, more than 300. And there can be different cases, and they are built in different years, and the program could have been changed, and they can differ. But there are some provisions, some standards that should be met, that are provided from the Ronald McDonald organization that is in the United States. And the facilities of these houses, they are in the close vicinity to the hospital. If I'm not mistaken, in many cases they are placed in the territory of the hospital. If there is free space, this land is allocated, or, for example, there were some overhaul repairs of some hospital or part of the hospital, and they found land to build this facility. So it's not so huge, so you can find place for it, for this house. So 2-storied building, technical facilities in the basement, and there is presentation. And all the rooms in Kraków, 16 or 18 rooms there. And these rooms, they are comfortable, but not presidential suites. These are just regular rooms, like in hotels. So the best solutions is the best solution is when this house is in the territory of hospital. This allows parents to visit their children easily, and if there are many procedures, so it is easier for parents to join their children, and that's why the location is of importance. Also, the interesting fact about financing of and support of such house in Kraków, it's about 20,000 euros a month. So this is not only about construction. So if we had some, for example, Jack Frost from the United States that would give us this house, Jack Frost comes only once a year, but you should deal with these matters daily. And I looked at the technical conditions, and this house is of good quality. There is solar energy, water, rainwater collected, and so to reduce, they did everything possible to reduce monthly cost of operation of these houses. And we should understand, when we want to launch such a project, we should understand that such cost will exist. Whether people should pay, no. According to the standards worldwide, it is free of charge. You should pay a deposit for electronic key, because these keys, they cost money, but this is a symbolic price. And when you return this key, you get money back. So staying there is free of charge. If parents believe that they can afford this, they can make charitable contribution to the foundation at the account of the foundation, but this is a separate case. So this is a decision of a person to do this.
12,000 euros a month. That is, I give you the example of Krakow, how much it costs in Germany, England, and the US. Who pays this money? Foundation. Foundation raises money. There's the program which we will also start here in Ukraine. The foundation, there are very simple decisions. There are small boxes which are located next to cash desks, and that's where you can put coins. And that is what our visitors do, and the task of McDonald's is to technically maintain that, because from time to time you need to count them and to transfer this money to the account of the foundation. That's one thing. Another one is there are some others. In Ukraine, if some other company joins or other company join this foundation, this is also possible, because any person can make a contribution to the foundation Ronald McDonald House. And that is why it works separately from McDonald's. It's a different legal entity. They have their own account, their reporting, the responsibility for that, and that should be done professionally, and also other companies, maybe there's no reason for them to launch some program individually, but they would like to share their funds with the people of Ukraine. They can also join that foundation. And that is done according to certain standards. Arno, I'm the consultant of Indian pharmaceutical plant, and at the same time I'm the member of the yoga meditation committee, which is set up at the Embassy of India. This is great that you have this in Ukraine. I was born in the kitchen in India, but that was the situation. My question is today we have the organization committee in the Embassy of India, yoga meditation for children and for adults. And there's a team that can spend some time teaching children relaxation, meditation, and some pranayama exercises. We are ready to cooperate, so if you have a chance, we'd be happy to offer such things to you. Any other questions? UCMC, I have two questions to Grzegorz. First one. In Poland, probably they have resolved that, but if maybe there are situations when the parents of children who are in intensive care units, there are more parents than the possibility to accommodate in the house. How do you address this issue? Who to give the priority for accommodation? How it works? It's an interesting question, and that was asked from the very beginning. You need to understand, if someone comes to the house of Ronald McDonald, that is for long. It sometimes could be for 1 year, for several months, and it's very rarely when they come just for a short period of time, and the doctors know when the whole procedure ends up and the child could leave the hospital. And then there's no sense for parents to stay there, knowing that they give this information to the head of this house, of this center, with who the Donald McDonald house is connected, and knowing who will come and who applied for staying at Ronald McDonald house, and then knowing what would be the procedure, how long it takes time. And they decide who to give the this place, and the process is organized in such a way that those people who have more understanding of the necessity for parents to stay next to the child, they were making these decisions, and this is a very delicate issue, and that is something which needs to be resolved in the very beginning. Again, for you to understand all these details. I give you giving you the example of only one house of McDonald in Krakow. How it's done in other places, it could be different. Historically, the program has been in place for 40 years. It started in different countries at different time, and maybe there are some other solutions in other cases, but here I talk directly to the head of the foundation, Madam Katarzyna. She works separately from McDonald's. She's heading this foundation. There was, at some point of time, the need appeared to have a special person dedicated to that, and this person well, she understands all the difficulties, all the situations, and this program and this technical component of how to address these issues, she has done that, and he agreed it with the doctor. I would like to add a couple of things. Next year, they are planning to open the room of McDonald in one of the hospitals. The house, it's long-term project, as Grzegorz said. It's quite an expensive thing, and the foundation has just started its work. Now their task is to launch this room, then think about the house and think about the rules, how this will be happening. This will all be done, this will be presented, this will be very transparent. There's a website of this house, of the foundation in Ukraine, so all the information will be transparent, will be understandable for all participants of the process. I'd like to add one thing. In Poland, it took 14 years to open houses, but at that time there was an ambulance and there was one room open. But if today we decided, no, we're not interested in the room, we will immediately start building the house, then practically that would mean that within few months we would be just raising money and we would be doing nothing. but this is this wouldn't work. From the very beginning, we need to do something very specific, so that it's not just showing off, but it should be real assistance, so that everyone sees that this helps. The room is what we can do first. The house is the future. It's more interesting. It's more like how wow effect. But you will need to wait. The time is over. After the event, you will ask this question. We are finishing. Thank you for your participation, and I wish you success.